pleasant good evening and welcome to our upfront segment of our news presentation. I have with me Kristen Van Acker, head of the International Diabetes Foundation, as well as leader of a visiting group of experts who are collaborating with the Rotary Club of Layamigo on a diabetes foot care program. Kristen, welcome to our upfront presentation.
Thank you.
Tell us about your position with the IDF and what some of your responsibilities are.
IDF, as you said, it's the International Diabetes Federation, and in fact they are overcoupling all the diabetic associations in the countries. And my role is there as a vice president who is responsible for the food program. You could say, what's food program? In fact, it's prevention of amputation by patients with diabetes.
Okay. Now, tell us about your objectives of this program, particularly keeping in mind the mandate of the IDF, and especially since I've heard recently that the amputation rate for diabetic persons it's very high, particularly in St. Kitts.
Absolutely, and I think there are two problems. Diabetes is going on in numbers. So can you imagine that we are doubling our number of patients with diabetes? So, and of course, if diabetes is coming up more and more, and especially for the Caribbean region, it's 20%. So that means for those who are listening, 1 out of 5 have diabetes. And if the disease is not well controlled, then you could have complications, and that's the diabetic foot. And it starts with an ulcer, but it ends with an amputation. So these numbers are very, very high. And the reason why the International Diabetes Federation wants to put this region in front of our program is because the rate of amputation is the highest all over the world, in the Caribbean and also in St. Kitts.
Now, so you would then say to our viewers that foot care is very, very important for a diabetic.
Absolutely. And if I can say for those who are listening, right? For those who are listening with diabetes, it's so important to have care for your diabetes and your diet, but also to look to your foot before sleeping. Just take a look. And if you can't do it yourself, I would say, ask your family members, ask someone to see if everything is okay, because that's the prevention. It starts there. Because if there is an ulcer, you will not feel it. That's a problem. Those who have diabetes can have, not obligatory, but can have the problem of loss of sensation. And if the blood circulation is bad, then even the ulcer is there, it can't heal. So we have also, as patients, some responsibilities, isn't it?
Right, to ourselves.
Yeah.
Tell us about the group of persons who are with you and what their roles were, because the program has concluded,
it's finished,
hasn't it? Right, in terms of carrying out that program that you came here to do.
I think there are two major partners. That's those who came from abroad. And I had Stefan Moorberg, Dr. Stefan Moorberg is from Germany, I'm from Belgium, and Simona Macono is a podiatrist, a difficult work. Podiatrist is someone, as a nurse, specialized for the foot care, and she came from Barbados. That's one part. And then we have the local faculty, those who were with us from the very beginning, who took responsibility. And in that club, we had Dr. Cameron Wilkinson, the surgeon. Then we have Nurse Brown, who is also very, very good in helping us in going on, and then Rotarians. And the one who was through the whole process there was Chris English.
Now, as far as you mentioned earlier that you've been here before, this is actually your third visit as you the program evolved. What would you then say has been your assessment of those patients who you saw before on your first visit or your second visit? Do you think that the message you were trying to get through to them has been effective?
Yes, we were surprised today. We were really surprised. I came 3 years ago here with my president, and then we just wanted to be sure that Rotarians who wanted to have this program in your place, that they could perform. And also one of the duties was we must be sure that the Ministry of Health was in the program, because when we are leaving today, we must be sure that there is continuity of this care. So we were asking our participants who were team members of the hospital, but also team members of the district centers of care, what have you done between we were coming and now we are leaving? And we have eyes like that. We were surprised what they have done. They have ameliorated their care. They have done a lot of attention to the patients.
Okay.
The only thing, of course, we have to improve for those who are not coming to the centers. We need them to come and have trust in those doctors who have won a lot of new knowledge. So there is a huge change. And to be honest, we were so surprised today. Even the Minister of Health, who is a lot of work, we know, she took the time to be with us. So that means, yes, there is an engagement of all partners like we have to be. Patients, the doctors, the nurses, the Ministry of Health, and Rotarians.
So would you then say that the teaching component of this program is just as important as the actual foot care program?
Yes, right. And even more, we have the teaching of the patients, the teaching of the healthcare providers, but we have also the reorganization of care, because we learned from the international side, if you improve your care, then you will have less amputations, and you can reduce it to 50% only by this. So we see the results, and they have improved. The doctors took time, a lot of time. Can you imagine, we were 2 days together, 10 hours work?
It sounds as if it was interesting, though.
Absolutely.
I think you've impressed upon me the importance of foot care for diabetic patients. I would like to give you the opportunity to perhaps impress again upon all viewers the importance, and particularly diabetics looking at this program, the importance of taking care of their feet.
Yeah. Even more, dear listeners, I think it starts with preventing diabetes. If I'm in the Caribbean, I feel always really welcome and warm, but we have to change our way of living all over the world, and particularly also here. Our food, we have to reduce the calories, we have to do more exercise. So that's first point, we have to prevent diabetes. And for those who have diabetes, one important message, we are wanted to go through it, please take care of the foot. It starts with inspection, because you will not always feel. For example, we saw a patient who had broken his foot some time ago, and without having the good care, he's suffering now for ulcers because his foot changed totally. Or you can have a nail, and you can put your foot on the nail and even not feel it, and it can have ulcers. If you have an ulcer, for those who are in this situation, please contact immediately your nurse and doctors. We say internationally, time is tissue. We don't want to have amputations anymore.
Kristen, thank you so much for dropping in and visiting us, and we hope you continued success with your program and with your work at the IDEA.
Thank you, Terry.
And that has been our upfront presentation for tonight. We thank you for joining us. We'll have our regional news presentation when we come back.